So today we are going to look at prevention and control, and then we are going to look at the treatment of other STIs and also the treatment of an exposed infant that is exposed to syphilis and viral hepatitis. As we discussed earlier, when we have a client who is a new client, he will come to Pages menu, expand that menu, and you will find General Population Counseling and Testing submenu. In the event that these clients do not have an account on the system, you will create new client accounts. If the client already has an account on the system, you come to Request Release of Client File. So we are going to use a record of a client that we already have on the system for this demonstration. So I'm going to request release of client file, and I'm going to use an ID that I have used previously by going to my records to look at any ID that I have here. So request release, select the record access date, which is today, is the 1st of March. Happy New Month, everybody.
Happy New Month.
Thank you. Same to you.
Okay.
Thank you. Good morning, everybody. Happy New Month.
Yeah, good morning. So the type of screening, we want to assume that this is for a prevention service. We are not screening this client. So I will say no to all types and submit. Now I will come back to General Population Counseling and Testing, then select the Collect Client Information. Now this releases the client file. And notice that on this flag, we have client has been registered for HIV care and treatment, which means that this client's previous test was confirmed positive and is now in care and treatment program. The client was also has a pregnancy record, and the last time the client was here, it was recorded that the client is pregnant and is still pregnant last 4 weeks ago. But we want to ignore that the client is in here and the client is currently pregnant. The client is here for prevention. The prevention and control for every client starts from registration. Once you collect the basic summary of a client, the system generates flags of the sexual orientation, the biological sex, the gender identity, the number of sexual partners, and if the sexual partners have been tested. It also gives you behavioral summary, and we don't have any summary here, which means that the client's risk behaviors were not filled in previously. So let's look at the forms that the client has. We have the personal information form, and we are going to fill this to remind ourselves what it contains. So today is the 1st of March, 2022. The client's name is automatically on the form because the names of the clients was entered during the account creation. We will move to the country of birth. So let's say this client was born in St. Vincent or in St. Kitts and Nevis, and the client now lives in St. Vincent. The address here is, let's say the client lives on Zion Hill, and the town, let's put Kingstown. The health district or wellness center, we'll use Kingstown. The parish, let's use St. George. The length of time in country of screening. So we are going to assume that this client has stayed 12 years in St. Vincent. The gender identity of the client. The client's biological sex is female, and the client now identifies as male. So let's make the gender identity male. or transgender. So her biological sex is female, and so she's transgender now, which means she's a transgender male. Sexual orientation is heterosexual. Now, clients will give you what they identify as and what their sexual orientation is, but it might not necessarily make sense to you because it might be conflicting, right? She's pregnant the last time. Now she says she's transgender, and we're just feeling what the client says. So I'm using this for demonstration. You feel what they say, not what you know it is or what you feel it is, right? So the sexual orientation of these clients, let's say she said or he said now he's bisexual. The telephone number, if you have it, you put it in. If not, you leave it blank. Marital status, he said is in a common law union. Ethnicity now is, let's say, Black. Occupation, self-employed. Highest level of education, college. Number of sexual partners, let's assume he said 5 to 9. Type of sexual activity, he has vaginal, oral, anal. He is currently pregnant. The client's regular sexual partner status, we don't know. Is the client alive or dead? The client is sitting in front of us. Is alive, cause of death is not applicable, and the client has lived somewhere else. And then you save this. So once this personal information form is filled up, the basic summary should be updated, and it's not here. And the reason might be because when this account was created, there must have been an error in this account. But under normal circumstance, if you create a new client account, so I'm going to do this for the new people that are here. In the event that this client is a new client and we are creating the account today, and the client was referred from an ANC clinic that does not use the system and is referred for prevention services at your health center or your testing site. So let's say testing and counseling site, NGO. The first name of the client, let's use Jane. The last name, James. The date of birth of Jane James, 7th of January, 1986. The sex, female. The mother's maiden name, I would say, is David. Then the testing code is generated automatically. Now we want to get a unique ID. I'm going to assume that we have her social security number, which we will use as a unique ID. SSJ D S6 22. And this is social security number. So once you do this, you go to the process now of request release of client's file. So this process we are going through now is the process you will start from if this is a returning client with an account on the system. So the unique ID was SSJ DS 622. And let's assume we're just going to be doing some prevention services. So now that I have collected this, I'm going to collect all of the required information, personal information, for us to see how it generates in the container. So the country of birth is St. Kitts, lives in St. Vincent. The address, town, Kingstown. So gender identity is male, sexual orientation, bisexual. Let's see. Marital status, common law union. Ethnicity, Black. Occupation, let's say the occupation here is employed. Highest level of education, college. Number of sexual partners, 5 to 9. Sexual activities, currently pregnant. Unknown, alive, cause of death not applicable, and yes. So once this is done, the basic summary is automatically populated with the information. Now, you see what happened the first time. If that happens when you use your live system, you have to send me an email letting me know, especially with the unique ID where you have that error. Because what the system is trying to do now is to filter out unclean data. So if previously in the previous years you've entered record in a way that does not work for reporting, it begins to block out any further transaction on that ID. So I'll have to manually clean those things. And so because we have been using this system for practice, enter a lot of wrong information collect, we just saw how that's happened with the past ID we used. So now we have the basic.
Mildred?
Yeah.
Mildred, would
Yes.
that mean then that you have to create a new unique ID?
No, don't create any new one. Just let me know once you have that error, just send me an email with the unique ID. I will have to clean it out from the database. The cause of the error, why the system stop accepting inputs for that ID. Because the thing is, when you have a client record with records or with data that was accepted previously, because the security now has changed, and those kind of information are not clean or the data is not complete or accurate for reporting, then it begins to stop anything on that account. So you don't need to create a new one. I just need to know, and within 24 hours, I will try to filter out that ID and clean out the cause of the error. Then it should be working fine.
Okay.
So now we have the basic summary. We do not have the behavioral summary, and the behavioral summary is gotten when you click on risk behaviors. All the questions in the risk behaviors are important for prevention. It is also important for reporting. And so we are going to do this. 1st of March, 2022. Has the client had sex with males? So we're asking these questions to see the risk behaviors in the last 12 months. So the client has had sex with males in the last 12 months. The client has had sex with females in the last 12 months. The client said she has never, or he has never had sex with persons of non-HIV positive status. The client said over 12 months ago, he has had sex with sex workers. The client said over 12 months ago, he had exchanged sex for drugs, money, or material gain. The client says in the last 12 months, he has shared needles and while injecting non-prescription drugs. The client says that he uses illicit drugs. He always has sex under the influence of drugs. He has multiple sexual partners. He does not have perinatal exposure to HIV. He has never received the transfusion of blood or blood products or clotting factor. He doesn't work in a high-risk setting. He has never been a victim of sexual assault. He has never received a transplant. He doesn't have any confirmed diagnosis of any STI at this time. We don't know if he has any TB at this time. He doesn't have any confirmed diagnosis. He said he has not had any contact with a confirmed TB case. And this question is for TB clients if they have been previously diagnosed with HIV. The condom use of this client, he says occasionally. And is the client incarcerated or have a history of incarceration? Let's say he said over 12 months ago. He was homeless over 12 months ago. he was a sex worker over 12 months ago, and he has had sex with transgender female over 12 months ago. So we'll save this. Once you fill the risk behavior, you have all the information you need for prevention. The other tabs, you can watch previous videos where we do the comorbid information, HIV screenings, TB screening, syphilis screening, other screenings. But for now, I'm going to skip this and we'll go straight to the prevention service, which is one of the focus for today. In this container, you have everything in red means that they are important for action. Everything in black means that these risks happened over 12 months ago. So it's a risk that is time sensitive, so that if it happened over a year ago, it's no longer a risk for having a current disease. Anything that happened over 12 months ago, but the time does not matter. Whenever it happens, it's still a risk. It's going to still be in red. So whenever you see behavioral summaries in red, it means that you need to read that carefully and know what you will do on the risk reduction plan. Below this, we will see that we have start risk reduction, get the last 3 recorded risk history, and risk reduction plan history. You can click on any of these buttons to go directly to that part of the system to start the risk reduction for the client and review all of the histories for the client. This is one way of getting there. But if this client already has an account on the system, you are coming in on a fresh day, you have no access to this file, you don't want to go through the process of requesting release and pulling out the file. The best thing to do is to come to Pages, then come straight to Prevention Control/PMTCT. There are several functionalities here. Track client's risk history, risk reduction history, listed contacts, report tracing, PrEP referrals, unlisted contact list, untraced contact list, sorry, and when you register pregnant clients for PMTCT and look at the PMTCT registration history for a client. These are all the prevention services for an adult and adolescent clients. We are going to look at prevention for exposed and pediatric later today. If you want to look at the client's risk behavior history before you decide what you want to do, since you have no file, you click on Track Client's Risk History, enter the unique ID, SSJ DS622. So this will give you the last recorded 3 with the most recent first. Every container is going to have a timestamp of when it was recorded. And since we have just one recording of the risk behavior, we have just one to review. So you can review the risk behaviors to see or to decide your risk reduction plan for the clients. Once you are done with that, you can come to risk reduction and then start risk reduction by typing the ID. Once you start typing, it will auto-suggest all the IDs with that sequence, and then it gives you the form. On the risk reduction form, you are to ask questions in any order, but you want to fill in the response to the questions. Now, the part of the client's risk behavior is that the client uses injection drugs, has sex under the influence of drug and alcohol. So the client definitely has injection drug partners and sexual partners. The client also doesn't use condom all the time. So you want to ask questions surrounding the risk behaviors. So put in the dates for the client. And the first question is, clients will talk about HIV concerns, risks to partners and friends. So you want to ask the client if they are willing to talk to their partners, both injection drug, family members, sexual partners, about the HIV concerns and the risks of their behaviors. And if the client agrees that they're going to have the discussion, you select what they agree. If it's not on the list or you had a more elaborate discussion, you can type it in here Clients plans to discuss HIV testing with partners and get them tested before having sex. You want to select if client is going to bring the partner to the site to be tested before sex again, or if the client will use condoms until partner gets tested, or client is going to abstain to sex until partner is tested. This just talks about the sexual partner of the client. And so maybe the client says they are going to start using condoms until partner knows their status. If there is any other thing that the client says, you can type it in here. If not, you move to the next. Client plans to change or stop seeing high-risk sexual partners. So if the client knows about a partner that they have who has other partners of very risky behavior, and they are willing to change their own risk behaviors and feel that the client poses a high risk to them or higher risk to them than their behaviors, they might want to break up with a partner, stop seeing such partner, or have fewer partners. And maybe he said he will have fewer partners. And if there's anything else, you type it in here. Client plans to change certain type of sexual partners. So if the client says they're going to get to know the partners better before having unprotected sex, or if they will remain faithful to one partner, or if they will abstain from sex. And so client has said he will get to know the partners better. So the next is client plans to stop alcohol or drug use. He said he's not going to stop, but he will avoid sharing needles. And then you can fill in any further discussion. Client plans to increase condom use. So the client will talk to partners about condom use and fill in any information here. If there's any other plan that the client has, so let's say the client will join a support group. For alcohol abuse, alcohol and drug abuse. Then, did the client receive pre-test counseling? So let's say you have decided to do a rapid HIV and syphilis test for the client. And so the client gets a pre-test counseling today. Did the client receive a post-test counseling? So let's say, yes. We are going to assume now that you've done the test, you are telling the client about the results, and so we're going to fill in this. If you are going to give the client pamphlets on HIV, or those information and educational pamphlets, you fill in yes. If the client is going to accept condoms, yes. The number of female condoms given, let's say 5. The number of male condoms given, 10. And then you save. Once you are done with this prevention plan for the clients, the next time this client comes, you can come to prevention and control and look at risk reduction history for the clients. And so the ID is this and get. So this will give you a table that shows the information you filled in during the last session. And for as many information as you have collected, or as many risk reduction sessions you've had, you will have that many rows. So if the client comes in several months down the line and you want to review the risk reduction, if it is actually working, if you need to refer the clients for PrEP or PEP, or you need to take better action, or if there's something else you can do, you can review it from here. Once you are done with your risk reduction, there is a part we didn't look at yesterday, which is looking at contacts that was listed by clients. So when you screen clients for HIV, syphilis, and other STDs, and the client becomes positive, or the client has high risk behavior, and the client has contacts listed, and the client wants the contact to be contacted by the provider, they're not willing to talk to the contacts by themselves. You list the contact on the client's file, and we looked at this in the earlier trainings. All those contacts you listed comes under listed contacts in prevention. All of the contacts listed from the antenatal clinics will be in this table. So far, no one has listed contacts at the antenatal clinics because the contacts were all screened. So there was no need to list them. The general population, which refers to every other person that is not antenatal on this page. We have a lot of contacts listed by different people who were screened and who were positive. These contacts that were listed here are now on this form to be traced. We have a contact code, which is the automatic code generated by the system to use to report the status of the tracing and fill in the tracing notes for each contact. If a contact is traced, the status becomes traced and then the reports for the tracing. So let's assume that we have these contacts to trace. You have the phone number. Let's take one with the phone number. And the contact was called in. The contact said they were going to come. They come in, you take the code. They come to prevention control the day they show up. So if they're called, you tell them the health center to come to, or if they're traced, you tell them the health center to come to, or if you take the tracing to them and you have a rapid test to take to them, you have the contact code against the person. Sometimes if you don't know the names, but the contact was registered with an address and a phone number, you can ignore the names. But for this practice, we have hypothetical names that different participants filled in with hypothetical numbers and addresses. So in reality, if you do not collect names of people, you don't need to bother about it. The system is built to suit the regulation of your country. So names are not required if it is not allowed in the country. So we take the contact code. We come to report tracing. Now, because that contact was from general population, you have to put it for other population. If the contact was from an antenatal clinic, you put it here. So I'm going to put in the contact code, and it gives me a form to report details of the tracing. So if the client is traced successfully, you mark as traced. But if in this event, the client was called and said they'll come in next week. So the contact was called and confirmed an appointment for, so let's say March 8th. So put in the date here, March 1st, 2022. Now you are not going to mark as traced until the person comes and you are done with this contact, then you come back to update the information. So in the event the person doesn't come, the system still keep the person's list as a contact to be traced to follow up and make sure that you get the contact screened or they know their status. Once you come back to listed contact, you will find that same contact now, and the status is still not traced, but there's a note left there. So you can use this note not to double trace someone. There is another functionality here that lists untraced contacts. So we'll come to untraced contact list. And this gives you all of the IDs of clients that have not, or the tracing is not yet complete. So you'll find a note here, but the client is still on the list of untraced. Anybody who is successfully traced and you're done with will not be on this list. The last functionality that we'll look at under prevention is the PrEP or PEP referrals. This is the same thing or the same form you get under the referrals when you are referring a client who has other STDs or viral hepatitis, but does not have HIV or TB for care registration and management. So either you do it from prevention or you do it from referrals and you use refer for other treatments and management. It is exactly the same form. If we are going to assume that this client has, let's say, hepatitis, and the client has syphilis, and the client has gonorrhea, let me refer the clients for those treatments. There is 1st of March 2022. The unique ID of the client was SSJDS622. The category of the client is adult, and I will refer. Now, this client has been referred for other stuff. Now, notice that we do not go through the process of the screenings, but we are assuming that we screened. The client has hepatitis, syphilis, gonorrhea. Once the client is referred at the testing site at the health center, if it is not a clinical management site, you are done with the client. You can now send the client to the clinic, the STI clinic, the ID clinic, or whatever clinic that the client needs to go to. If the clinic does not use the system, you might want to give your paper referral. If the clinic uses the system, the client can just go to the clinic, and then the clinical management team will come to clinical management, select other care card, put in the client's ID, get card. This form gives us forms for treatment where they can prescribe PrEP or PEP, forms for registration for hepatitis cases, registration for syphilis cases, and other STDs. But before we go on with this case, I will pause, take questions. Any questions from anyone?
No, not from me. I am familiar with this type of reporting.
Yeah.
Thanks for asking, Mildred. Not from me right now. Thank you.
Yeah.
Hi, Mildred. Good morning. I am at the clinic, so I have to be moving off ever so often. And then our internet cut out a few minutes ago. So if you could just go over this last part for me, I'll be grateful.
Okay. So this client was screened, right? We're assuming that the client was screened. The client was reactive to both VDRL and TPHA. The client has gonorrhea and the client has hepatitis. And the client was referred for treatment and management. And so the client has been sent from the health center or the testing site to the clinical management team at the STI clinic or the infectious disease clinic. And the client presented now, and the clinical management team comes to clinical management and selects other care card. In clinical management, we have 5 functionalities. You have to view waiting clients, and this waiting clients is going to be populated based on appointments. So if you go through the appointment process, the client has an appointment, the client's vital signs was recorded by the nurse before the client is ready for clinical for the doctor, then you find a list of the people here. This is required for all HIV management. For TB and other case management that is not HIV, you can skip the appointment processes and the create visit process and go straight to care card. If you want to keep things organized, if it's the same doctor that sees all infectious disease, you might want to use the appointments to structure your time. So all HIV must have an appointment. They must go through the process of creating a visit. TB and others is optional. You can go straight to the care card For people who have no HIV, no TB, we're referred for PrEP, viral hepatitis, and other STDs management. You come to other care card, enter the unique ID, and it releases the card for the client. So that is where we stopped.
Thank you.
Okay, so the next part is confusing and intense. So we are going to take a 10-minute break before we move to the next part. Is everyone okay with that?
Yes, I'm okay.
Okay. So we are back. Is everyone back?
I'm here.
Okay.
I'm here.
Okay, so before the break, we looked at getting the care card of a client. Now, while the system can release the care card for the client, whether the client is in care or not, as long as the client is referred, you want to prevent future errors, and you want the system to be able to calculate those who were referred for other services by coming to care registration and initial evaluation. And this is for the clinical care team, where you always view all referrals and register the client into care before they start seeing the doctor. So it's just the same process that happens in an everyday clinic, where somebody walks in to a clinic for the first time. You want to register the person and to have a file in the clinic. But in this case, the system has a file for TB and other registration as soon as the client is referred. You don't need a registration to release the file, but you need a registration to be able to accurately calculate the number of people who were referred and who actually came to the clinic. So for these clients that we have, we will see that here there is no record of HIV screenings for these clients, no record of syphilis screenings for these clients. All of the files for every client will have flags for HIV and syphilis screenings. If no screening has been done, you will find it in red. If your screenings have been done, you will find it in green. Now, because we are assuming the client was screened and we do not have the record on the system, if you want to record this on the client's file so that even the testing site and the health centers will have the test results, you take the unique ID and you click here. To view client screening results or record new screenings, click here. So this time you put in the unique ID, get file. This gives you a container where you can fill in screening results. So let's assume that we screened this client for HIV today. The test modality is, let's use health facility, type of test, rapid, test kit, determine, and the result is non-reactive. The date is today. The TB screening. There's no TB screening. We'll go to the syphilis screening, fill in the dates. So we are going to assume that we are doing things very fast. The PDRL was done. The titer was 128. The result is reactive. The date is today. So this is March. And save. So other screenings that we are going to do is the hepatitis. And we have hepatitis B, So we're doing the surface antigen, and it was so let's say the result is positive and the date is today. We also have another screening for, let's just skip to gonorrhea. Let's assume that we've recorded the others. So I don't have gonorrhea on the list, but if you do have it, this is where you come to record the screening. When you don't have a screening on the list, what you do is to go to your configuration and add the screenings that you do not have. So I'm going to leave this since we don't have it. You notice that for all the screenings I recorded, the right side of the page has the history. So for as many screenings as are recorded, you will find them here, the results and the dates. Once you are done with this recording, you can come back to your clinical management care card, enter the client unique ID, and go back to your care card. So this time you have the flags in green because the system now has a screening. Yes, you can confirm for syphilis. So if you, assuming that we did the VDRL, you want to confirm that it is syphilis, you will come back to syphilis screening here, and I will put 1st of March, 2022. This time we're going to be doing TPHA. Now your configuration will list whether you're doing TPPA, TPHA, FTA, but this is what we have on our configuration now. You configure your system yourself, so you have the list of your screenings. So now the result here is reactive, 1st of March, 2022. So once it is confirmed, you have both results showing on the right. So let's go back to the care card where all the action happens. Now, on this care card, we are going to assume that the confirmation for hepatitis has been done. This client has hepatitis. Other screenings were also done, but we are going to skip the process of recording or requesting those screenings. But in reality, you request the screening, you will have the results, and you are going to work based on your results and your diagnosis. So we want to assume that all these have been confirmed and they are diagnosed, and we're going to fill it. We have a form for hepatitis registration. If this client came in with just syphilis, he will skip anything to do with hepatitis and go straight to the form where you can register syphilis, chlamydia, gonorrhea, and other STDs. So now this client has hepatitis, so we're going to be doing all the registrations. So the date is, the month is today, 2022. The clients, so we're going to find out if the client is pregnant. If pregnant, yes. If not, no. Expected date of delivery if pregnant. I'm going to switch clients and leave this ID for your personal practice. So you can copy this ID now. I'll put it in the chat and I will not fill this in. And I'm going to switch clients and use a pregnant client for demonstration. So if you want to follow with practice later on, you can use this unique ID to look at other prevention service for an adult or an adolescent. So the ID is in the chat, and I'm going to switch clients. I'm going to use a different ID, and let me see the list of referrals. Yes, question? Okay, yes, you can do your hepatitis B viral load. As many screenings as you want to do, you can record them there. But we're going to skip all those processes and for the purpose of this demonstration. But in reality, when you come here to record all the screenings, you'll record as many screenings as the client does from the other screening. So there's an exhaustive list of the type of tests that you will enter or create during your system configuration. So a person from the lab will give the program manager has the list of all the tests that are done in the country and the ones that are sent overseas, and you can populate your system with all the screenings so that when it's time to record the results, you have them on the drop-down menu. So you can record all of them, every type of screening that you want in the name that you want it to be. So if you do an ALT for this client that has hepatitis, AST, you put in all your values as you want. So for anything that is not HIV, TB, or syphilis, you use other screenings and you record them one at a time, and you can put in all the values you want. So if I record this ALT value for this client, so let's assume that the client has an ALT of 2. So let me give an ALT that indicates some liver condition. And the result is not applicable because we put in the value. Save. So for as many other screenings as you record, you will find it here. So use the other screenings tab to record any screenings that you do. You can paste in the report here if there's a screening with reports, or you can upload screening results here if you have a file or sheet for the results and you want to upload, so that you just click to view rather than typing values. I will come to look at the list of referrals. I want to use another client who is pregnant, and I'm going to use this client. I will register this client into care. I want to follow with the AMTCT, so I'm switching clients that for the demonstration. When I want to register this client, I'm going to do other care registration. And we did this in previous weeks, so I will not elaborate on this. I get the form and I register. So the ID is KK001. Now I'm coming to other care card. KK001. And I have a card. So the story I'm going to follow is for this lady is hospitalized. She is pregnant in her 25th week gestation. She is in a situation where she might require a transplant or something. So we're going to use an extreme case to collect data. So let's register her for hepatitis. She was registered, let's say she's registered today. She's pregnant. Expected date of delivery is on the 12th of June, 2022. The case was found through antenatal screening. The type is hepatitis B. Confirmation status, we're assuming this is confirmed. And so you want to put in the screening results for all the different screenings that was done. So let's say this was done and positive. Let's say this is awaiting result. This is not done. This is awaiting results. So let's put awaiting results for the rest. So you can fill in the value as you have them if you do the screenings. Other exposures. So you want to look at other medical exposures or medical risks that the client has. So we want to do the audit score. The alcohol use disorder identification test score. So we'll say she doesn't have any alcohol misuse. So I'll put 2 or 1. Diabetes, we're assuming that she's diabetic before pregnancy. So we're looking at the alpha-1 antitrypsin deficiency, no. If she has Wilson disease, no. Autoimmune hepatitis, no. Primary biliary cirrhosis, no. And hemochromatosis, no. So let's say no. So she just has her infection. Once you save this, the values are retained. So when you need to update anything, you just update the field that needs updating. Once the hepatitis registration is done, you come to hepatitis diagnosis, diagnostic data, and category. So she was confirmed on the 1st of March, 2022, the laboratory confirmation of case category. So based on your clinical judgment. Is this a newly acquired case? Is this, or based on the laboratory confirmation? Does the case meet criteria for newly acquired or does not meet? So we'll say this case does not meet any of the criteria for a newly acquired case. The type of case is, so we're going to put end-stage disease. You can have a case, new diagnosis, transplantation, death. So if you're recording this after a client has died, so you put death. And if it's a new diagnosis, it's an end-stage disease, transplantation. So we're going to say this is an end-stage disease. So the symptom that the client has abdominal pain, liver abnormalities, elevated liver enzymes. We are going to fill in all of those values. We are assuming the client has cirrhosis, but we'll fill in later. Jaundice, vomiting, dark urine, fever, loss of appetite, rash, clay-colored stool. Any other you specify here. Want to look at the clinical diagnosis. We said, let's say this is chronic hepatitis B, or whatever clinical diagnosis you want to put there, or specify others. Want to look at the consequence of this infection. Compensated cirrhosis. So let's say yes, clinical diagnosis of cirrhosis, we'll say yes. Imaging, no. Pathological, let's say yes. AST is done, and we'll get the value of the AST to be, this should be higher than this in end stage, but I'll just put this for now. 262 per liter. So in reality, you put the real values. This is just for demonstration. ALT for cirrhosis, ALT should be lower than AST, right? So I'll say this is done, and we'll put this as 223.7. That's what I filled in on the form. Platelets, let's say our platelet is also getting low, 131 liter. So did we do a fibro test? Let's say fibro test was done, and the fibro test score was 0.7, which puts the client in F3 and puts this client in advanced fibrosis. Fibroscan, let's say not done, there's no report. So let's do the staging of the cirrhosis. And we use the Child-Pugh staging. So for us to get the stage, we have to fill in the other values below: encephalopathy, the ascites, bilirubin level, albumin, and the prothrombin. And so we're going to put this at, let's say, grade 3 to 4. We are putting this at controlled 2. We are putting the bilirubin at, let's put 5. Albumin 1.5, prothrombin time 2.5. So if you look at the total of these points, 3 plus 2, 5, 8, 9, 10, 11, 12, 13, 14. So this is final stage, right? 14. So it falls at staging C, 10 to 15 points. Are we diagnosing hepatocellular carcinoma? No. Or not diagnosed? No. Nope. Can say. So you fill in the information you have, and you can come back to updates later. So I'm just trying to fill in everything so that we can walk through all of the information that the form has for you to give recommendation if anything that you normally use in the clinic is missing. So you have this information saved on the page for the clients, and you want to look at the risk factors for hepatitis and the reason for the test. So put in the date. On every form, there is a date. So the client has, you want to find out if in 6 weeks prior to the onset of the symptoms, if the person has had any of these risks. So 6 weeks prior to symptom, the client has had, let's say the client already is not vaccinated for Hep B. The client uses injection drug. The client is a hemodialysis patient. You read through all the risk factors, so say hospitalization also, and you select what applies to the client. If there's no risk identified, you click no risks identified and leave the others. The reason for test, the client was tested as antenatal screening, also was tested because of evidence of chronic hepatitis, elevation of liver enzymes, and also if there's any other reason you specify here and save. Now we filled in all of the hepatitis information and all the data collection for this hepatitis. It is time for us to move to the other STDs. Now this is supposed to be specific for syphilis, but because we always get chlamydia, gonorrhea very frequently, and other STDs, especially with HIV-infected patients, so we allowed the form so that it can collect information for any STD or PID you want to fill in. So we said initially that this client also has gonorrhea. So put syphilis, gonorrhea. If there's any other not on the list, you put it here. For a client that has syphilis, you want to put what type of syphilis, the primary, secondary, late or non-duration. So let's say this is late or non-duration or no symptoms greater than 1 year. For gonorrhea and chlamydia, let's say this is resistant gonorrhea. If you have, the client has other symptoms that is related to any of these diseases, you fill it in here. If not, you save. So it retains the information that you put in, and you can update by selecting any other information for later use. Now for treatment, you want to fill in the medication for the treatment that you are going to give this client for the pharmacy to dispense. So this client is hospitalized and the client is pregnant. The client has syphilis, the client has hepatitis. So I'm going to fill in one medication or one drug and to give you the idea of how to fill in. And then we are going to look at the exposed infant. So because she's pregnant, let's say penicillin might be the only safe. I'm not sure. Penicillin might be the only safe medication. And we're giving penicillin injection. So the dose for the injection is normally 2.4. And you give that 3 doses at 1 week interval. So let me copy these 3 doses at 1 week interval for duration. I'll add another medication, let's say for the gonorrhea infection. So regardless of the safety in pregnancy, I will just select and we'll do the right thing in real life. So for the treatment is both what is prescribed, and if the client is currently taking a medication that is not recorded on the system, you might want to put it in so that when prescribing, you don't double prescribe the same thing they already have. So if the client is coming in and you are using the system for the first time and the client already has medications that they are taking that is not here, you might want to put in what they're taking. And if you are prescribing new medication, you also put it in. So for the gonorrhea, we are going to put, let's say, azithromycin. And this is other treatment. This is 1,000 milligrams. And this will be orally and once. Also, you want to give for gonorrhea, I think you give this other treatment. And this will be 250 milligrams. Also, you want to give this, let's say, injection form, and you want to give once. Okay, so you put in the real thing in reality. Once you fill in the treatment, then you have all of the medication that the client has been prescribed here. Two things you might want to consider. If you put in the medication the client is currently taking, what will happen is that the date prescribed is going to be your current date. It won't be the date that the client got the medication from wherever they got it. Why that is because if you are putting in a history of a medication the client is currently on, that is not just a new prescription, the pharmacy is not going to dispense that drug. And if the pharmacy doesn't dispense, you are not going to see there is no history of dispensed medication for this client on the system. If you come back here in the next 2 days and you still don't find any history of dispense on this page, it means that either the client has not picked up the medication from the pharmacy, or the client picked up but the pharmacy did not record. But it actually gives you a way to know if the clients have actually picked up the medication and the duration of time between prescription and drug pickup. So that way you can address issues like client-related problems or healthcare-related problems if it's a drug stockout problem or is a problem of, so you can actually know why there is that time lag between prescription and dispense. So you fill in all the treatments you are going to do. There's treatment monitoring for in the event that this is a PrEP or PEP client and you are monitoring, you want to do the renal functions or say diabetic client, whatever, you will select from the list of screenings that you want to use for treatment monitoring, the date that it was requested, and then you put in awaiting results, or you fill in a result if you have the result, and you find the history for treatment monitoring here. If you are taking the client's vital signs on a new day, you fill in the vital signs of the client. So let's say the pulse now is respiratory rate. The client is, let's make the client obese. The height of the client, and so the BMI. So you will find all of the vital signs history on the right. So if the client is hypertensive, you can monitor over time how the blood pressure fluctuates, or the pulse and the respiratory rate. So this is all about care for viral hepatitis and other STDs, and also the form you will use for prevention. So in the case of prevention, you will forget about you will not fill the hepatitis or the other STDs form. You just use treatment and treatment monitoring vital signs. So for a client who was referred for PEP or PrEP, you are using treatment monitoring vital signs. If the client comes down with any STDs, you use this. If the client comes down with viral hepatitis, you use the first 3 tabs. If you need to record screening results, you click here, enter the unique ID, and get the forms where you record the screening results. And this is where it ends for adults and adolescents management and prevention. Any questions before we move to exposed infants?
No question from me, Mildred.
Okay. For an exposed infant, previously we looked at registration of exposed infants for HIV. But we have instance where a client or an infant is exposed to syphilis or hepatitis. For such situations, the clinical care team will come to care registration and initial evaluation. And this time, instead of using the exposed infants HIV care registration, you use exposed infants other care registration. For all exposed infants that are exposed to syphilis or viral hepatitis, use exposed infants other care registration. If the exposed infant has an infection with HIV or an exposure with HIV, syphilis, and viral hepatitis, use exposed infant other care registration. Only when the infant is exposed to HIV alone will you use exposed infant HIV care registration. If the exposed infant is exposed to multiple stains, you use exposed infant other care registration. So I'll click on this. And it gives us a form where we register exposed infants. So the date of registration.
One question, Mildred.
Yes.
As it relates to the adult, right?
Yeah.
In previous training, you were saying if the person is HIV as it relates to the adult, HIV, hepatitis B, syphilis, whatever, you're doing HIV registration because the others will fall in place. What is the difference for the exposed child?
Okay, because we have different, the reporting requirements, how the data is stored is totally different from how that of the adult is stored. An exposed infant, HIV positive is HIV positive, right? But exposed infants is not necessarily positive. So if you register an exposed infant for HIV, the system generates initial evaluation forms for HIV for the exposed infants. If you register for others, then it generates a care card for management of others. And you also want to get a case report to monitor congenital syphilis. So the process and the requirements are different, and that is why it is totally different from the HIV. Because now for HIV, it's just data collection and reporting. For the exposed infant, data collection, reporting, and also the whole EMTCT reporting, which is a totally different system.
Okay.
Yeah. So let's give this hypothetical exposed infant a name. So we have an exposed infant. I'm going to name this infant Brown. And doesn't have a middle name. The last name is Daniel. The date of birth of this infant is 1st day of February 2022. The mother's ID, I'll put in any ID. The mother's maiden name, the infant's ID. So we want to generate an ID for the infant. You use whatever algorithm that you use in your country for exposed infants. BD00122. The health district, let me use Kingstown, Parish, St. George. Sex, male. What is the infant exposed to? So we want to say this infant was exposed to both syphilis and hepatitis. If it's hepatitis alone, you select this. Syphilis alone, this. Both. So the weight of the child at birth was, I'll say 7.5 pounds. The length of the child at birth, 48 centimeters. And then the type of feeding for the child, the mother said exclusive breastfeeding. So we register. Once you register the exposed infant, you can now come back to the same process, clinical management, and get other care card. Enter the ID for the exposed infant, get care card. So this gives you the same form we saw the last time, but this time the form generated for an exposed infant is totally different from that of an adolescent. And we looked at this yesterday, so I'm going to repeat it for the people who are just joining today. We have the unique ID, the sex, and the date of birth of the infant. We have the flags. If we need to update any results, we click here, put in the ID and update, like I showed you previously. But now what is different are the forms. We have the vital sign forms. So let's fill in the form. So let's say the infant has a fever, the blood pressure, the pulse, respiratory rate. I'll put something a little high. The weight of the infant now is in pounds. The infant is now, let's say, lost some weight, 7.2 pounds. The length of the infant is 49 cm now, and we have the BMI. The head circumference, chest circumference, mid-upper arm circumference, and then we send. So once you record the vital signs, you have is on the right. So we have the perinatal hepatitis case report for an exposed infant. This asks you information of the registration date, the mother's date of birth, the number of pregnancies that the mother has had, number of live births, the LMP before delivery, the date of first prenatal visit, the trimester of the first prenatal visit. If the mother received any antiviral treatments during pregnancy, you put in the treatment received, and then the date treatment was completed here and saved. So that is what this form contains. The second form is the perinatal hepatitis clinical and diagnostic data. It collects information on both the mother and the infant. It asks for the dates or if the mother was confirmed positive for hepatitis prior to delivery or after delivery. Then it also asks questions of the results for the different screenings that the mother must have done before the mother was confirmed. And then it gives the infant screenings also for the diagnosis, and also the tests, the reason for tests for the child or the infant. And this is because of perinatal exposure, the symptoms the child has, if any, and then the onset of symptoms, if the child or the infant has any symptoms, the liver enzymes of the child at diagnosis. So you record the SGPT of the ALT, the dates, the value, the AST also, date and value, and then bilirubin also, the vaccination history, have B vaccination, so HBIG, and then the other first, second, third dose. The infant's outcome. So you save this. If the infant later is hospitalized or dies, you fill in this outcome. If not, you leave the outcome blank. The next thing is congenital syphilis case report. So in the event where this child or this infant was referred because of syphilis exposure, you will not fill in anything about the hepatitis. You're filling in hepatitis only when the infant was exposed to hepatitis. So syphilis, you are going to fill in the report, the same maternal information as on the hepatitis form. You want to fill in the test that the mother did, the trimester when the test was done, the stage of the syphilis that the mother had, if the mother received the first dose of penicillin injection, and you fill in order, or when the mother received the injection, and you want to put in the treatment received and what the outcome was. So in the event where this was in the first trimester and the mother was treated and there was appropriate serologic response, you want to fill in what the outcome of the mother's treatment was. The next is the clinical and diagnostic data for the infant. If you have any, you fill in all of the gestation age at delivery, the screenings for the infants, and the confirmatory test. Then you also want to do if the child or infant had either a dark field exam, a TFA, or a special stain. If the child had it, you want to fill in the results. If positive, and the child is a case of congenital syphilis. If negative, you fill in the information of classification of the case, if it's not a case, if it's a confirmed case, if it was a stillbirth, maybe you fill in this information when there's a stillbirth from a mother who had syphilis infection during pregnancy. And you are going to fill in the infant's outcome if the infant is positive and maybe the infant is still alive, the infant was born alive and then later died, or the infant was stillborn. You fill in the date of the death of the infant. The treatment is the same as that of the adult. The treatment monitoring also for the event you are treating hepatitis or the infant was confirmed syphilis and positive. The symptom review for every visit for the infant and the immunization recordings for the infant. And this concludes. I'm not filling this form. I'm going to share the video from yesterday because we filled these forms yesterday. And I just scan through the forms for you to see the information it contains. So these are the two types of forms we have for the exposed infant or the child, and that's for the adult or the adolescent. And this concludes all of the prevention functionalities for the system. So I'll take questions before we discuss the self-test. Anybody with questions, clarification, suggestions? Okay, in the absence of questions, I will discuss the self-test, which is one of the reporting requirements. If you notice, when you come to the home page of the system, you will find a form where clients can record their self-test results if you give them self-test kits. So part of the prevention is, in addition to giving clients condoms and prevention materials, you can also distribute self-test kits. Now, while this design is going to change shortly to be included in the general population, to include the distribution in the general population and also in the pharmacy, and to also include a way where you can track the people you're giving self-test kits and how you can follow up with the reporting in the event you want to follow up and get data about their self-test, if they did the test, if they used the kits, and what the results are. What you do in country for the front end where the clients can register their test is to give them your site address. So for Dominica, it will be domcbs.org. All the countries have their site address. You give it to the client. You can give it along with the test kit, write it with the marker on it, and tell them once you do the test, they can decide to come to that site and register. This is very mobile friendly. So if you put it on your phone, it displays in a mobile version for ease for the clients to use. So when they get that, they have an account on the system. We want to encourage them to use their unique ID so that the system links the self-test to their accounts. If they do not have an account, or you gave them like 5 self-test kits, they want one for themselves and one for sexual partners for high-risk clients. And they want sexual partners to know their status before, or injection drug partners. Those clients do not have accounts on the system. They do not have unique ID. They can generate one, leave it blank, and just register the results. So I'm going to add a new column here that gives the test kit serial number, so that in the event they don't have a unique ID, the kit has a serial number where it can be tracked. So we looked at the self-test yesterday, and so when I share the video later on, you will see the other discussions we had about the self-test. So this concludes the ECBS training workshop. Tomorrow we have the mock clinic, which is required for all participants from testing to clinical management. We have that tomorrow, and Thursday, where we run the system from the start to the finish. So come with your cup of coffee, your water. We're going to take a long time tomorrow and Thursday. Next week, we go straight to reporting for supervisors and statisticians and surveillance officer, where we are going to look critically at the reporting indicators, the reports generated on the system, and see if it meets all of the requirements. So if you have no questions, this is where today's session ends. I'm going to email the case scenarios that we will use for the mock clinic and that you can use for practice. If you have account-related issues, you can send me an email with your email address, and I will create new accounts or rectify your problems before tomorrow. You can tell that to all your colleagues also who are here, who are not here, who do not have accounts on the training system and on the practice, on the training system and on the patient management and reporting system. So everyone should have both accounts. If you do not have account on the training system, you will not be able to take the assessments. If you do not have account on the patient management and reporting system, you will not be able to use the case scenarios for any hands-on experience. So send a message to your colleagues, let them send an email with their first name, last name, email address. If they have difficulties logging in or they don't have an account, you can also give them my phone number and I'll try as much as possible to rectify all account-related problems before tomorrow. Any question, comment?
Just one question, Mildred. Did you get to do the workflow?
Yes, I'm going to do that, and I'm going to send everything in one package.
Okay.
So hopefully before the end of tomorrow, I will send that. I'll send an email with the assessment IDs, the access code, the reason for each of the assessments. So I'm going to send everything in one file so everybody will have it.
Okay, thank you.
And did you have the time to clean up the system?
Yeah, I've not cleaned it up yet. I wanted to have cases on the system that we will use for practice today. So what will happen is at the end of this training workshop, I'm going to wipe out the database and we're going to start afresh tomorrow. Or I'll wipe out the database so you can practice now with less errors and we'll see the effects of the practice. So I'm going to do that after this session.
Okay, thank you.
All right.
So, Mildred, after today, we can go ahead and start practicing. Is that what you're saying?
Yeah, you can start practicing now. I mean, the practice has been on from the beginning. So just give me until after this, 30 minutes after this session ends, you can go and start practicing.
Okay.
Yeah.
Thank you, Mildred.
You're much welcome. All right, so have a very good rest of the day and a very blessed month. We are going to see tomorrow.
Thank
you. Bye-bye. Thank you.
Bye. Have a blessed day and a good night. See you all tomorrow morning. All right. Bye, everybody.
All right. Bye.